All right, Heather, thank you for that excellent introduction. Welcome this afternoon. And really, I tried to title my talk here real quick, what are we learning about antibiotic use after implementation of the FDA guidances? So Heather kind of talked a little bit about it. I was going to go into just a little bit more detail briefly before touching a couple of areas on the FDA antimicrobial sales and distribution report. As Heather said, we don't really have a good tool for on-farm usage yet, and certainly we see in the FDA they're very interested in having that come to fruition for all livestock species, so there'll be more to come. But this is at least somewhat of a proxy that, as Heather mentioned, the best guess. So a little bit more about that. Each year the FDA reports, they have all the companies that own antimicrobials have to report their sales data, so it doesn't, once again, reflect direct usage. And so they've been doing it since 2009. This year is the second year where it was split out and reported by livestock species as best they can. So, so if you look at that, broken into a couple of classes, looking at antimicrobial sales by class of antibiotics for all livestock species, you can see that medically important antibiotics comprise about 51% of the total, and that's kind of broken out by groups, tetracyclines being the large portion of that in all livestock. It's about 64% of all the medically important antibiotic used are tetracyclines, followed probably by the penicillins and then a bunch of these smaller classes. The non-medically important antibiotics, and the ionophores being the large part of that, that's about 49%. So when this report came out in 2017 for 2016 data, that was 60% medically important and 40% non-medically important. So you can see from a livestock species standpoint, we certainly started to see the reduction that Heather showed in the medically important and probably saw a slight increase in the non-medically important antibiotics. This is the big one, as Heather mentioned. This is looking at tetracyclines by year for all livestock, and you can see that there really was a steady increase through 2015 as being the kind of the 9-year high there. 2016, though, and that was a year before the regulations were fully into effect, we saw a 15% decrease even before the new regulations took impact. So really from the standpoint of producers starting to have those conversations with their veterinarians and ask, hey, we've always run Thailand, 20 in the finishers all the way through. Is that something that we still need to do? That may have been done more when we were finishing animals outdoors or in open flush gut type of buildings where they're exposed their feces. Now today, many of the animals are raised in all out facilities that get sanitized and washed between that. So certainly probably has decreased the need for some of those more routine and common antibiotic usage. So certainly started to see the impact of the education things that Heather talked about in all species. Really started to see a decrease even before the implementation. Then here on tetracyclines, we saw a major reduction of about a 30 to 40% increase there over this past year after the implementation of the new guidelines. Just trying to look at a couple of the other common classes, why I say they pale in comparison to tetracycline from the medically important standpoint. You can see here we have the penicillin group in blue, the macrolides, so that's things such as Palmitil and Tylan and Draxxin there in orange. And in gray, you've got the aminoglycosides, so that's like your neomycin, gentamicin, those type of antibiotics. And you can see they kind of all show the same trend. This is all livestock species again, but in each of the three from 2015 to 2017, you see that same sort of decrease in usage, or at least sales, decrease in sales over the past 2 years, similar to what we saw with tetracycline. So if we break it out then and we start to look at some of these differences by species, you can see that cattle and swine, the overall is about a 33% reduction, as Heather mentioned in hers, but you can see in cattle and swine we had significant reductions. Poultry had a significant reduction, but from a medically important antibiotic standpoint, they didn't use near as many. Turkeys and others. So really across all species we saw a near similar reduction in medically important used antibiotics. So a little more interested in just looking at the swine, since they do break those out by sales of certain products and what they're labeled for. So once again, that doesn't mean it's reflective of all usage, but kind of gives us an idea there. And you can see you had about a 37% decrease in tetracyclines, about a 44% decrease in the macrolides. Some of the other ones, aminoglycosides, saw a small decrease. Lincosamides actually went up a little bit in swine, and penicillins, there really weren't a whole lot to begin with. So really echoes the message, I think, that Heather presented in her slides about certainly starting to have those conversations, at least taking a look at places where, hey, maybe we don't have to use that antibiotic before like we have in the past. This slide, taken directly out of that report, kind of graphs out and looks at the medically important antibiotic use by route of administration over the past 9 years. And what you can really see there, the vast majority of that reduction coming in feed, you can see the very large decreases, especially between those last 2 years. The injections were pretty flat. I think a lot of people expected, well, there'd just be more use of antibiotics in water. That really was not the case. If you look here over to the right, you can see there actually was a fairly sizable reduction in all livestock in water as well. So the reduction in antibiotics, it wasn't simply a substitution of water for feed to get around the VFD. It really was a reduction in both of those mass medication applications. This is looking at the non-medically important antibiotic use by species. You can see in swine, we've only got a few products, so we really didn't have much of an impact there. Say pretty flat to maybe a slight reduction in the use of non-medically important antibiotics over the last couple of years. So Heather really did a nice job of summarizing what those decreases were, and that we also, another thing I thought was interesting was seeing the decrease in the water-soluble medically important antibiotics as well. A little bit here looking at some data that was so kindly shared by Global Vet Link, looking at some of their VFDs across different species, what they were written for. You can see this subset of data there represents about 3,000 veterinarians, about 5,400 feed mills. And a recent survey that I had the opportunity to participate with Dr. Lee Schultz and his grad student looking at implementation of VFD both before and after. We certainly saw a high number, probably in that 70 to 80% of veterinarians were choosing to use an electronic service, and with Global Vet Link being the primary one to write those veterinary feed directives. So you can see, about 2/3 bovine, not quite a third was swine. You see a little bit of sheep, and then some in the other as well. So we looked at looking at understanding how the VFDs were written. What were the sizes? Because one of the things that you need to put on the label of those is how many animals are on each of the VFDs. So there's questions: do you fill it out per group, or can you do it per barn, or per site, or even per flow of pigs? So just looking at some data before or between 2017 and 2018. In all the species, we see that there's maybe a few less VFDs being written, and a few more head per each of those VFDs being written there. You can see with swine having the largest numbers there. Of the three that are graphed, some of the interesting ones that we added, or that they chose to share, we're looking at poultry, aquaculture, and then honeybees, which was really kind of interesting. Didn't realize that there were antibiotics used in those, medically important antibiotics used in those applications, so we actually had number of head on there as well. So just looking at the swine, breaking out in a couple of different categories, you can see most of them are still being written for fairly small sizes, less than 2,000 head on a VFD being the most common, but also 2,000 to 5,000 being very common. If we look at the 5 to 10, 10 to 25, or the 25,000 plus, we continue to see that some VFDs are being written for those, but those tend to definitely be in the minority compared to the VFD written for the smaller lot sizes. What were some of the indications that they were being written for? You can see, and it's a little bit dependent on the label for the feed grade antibiotics. So enteritis and pneumonia, that was probably a pretty popular one for tetracyclines, as you can imagine from the report being the predominant antibiotic that being used. If we kind of combined, they did a good job of combining things for ileitis and dysentery. That kind of represented about 17% of the VFDs that were written, and about 12% pneumonia, and then just a couple of percentage in some of the other categories. If we looked at by active ingredient, you can see chlortetracycline. That's about 60% of the swine VFDs that Global Vet Link wrote for were for chlortetracycline. The next highest were for Tylan and tilmycosin, so that'd be Palmitil. We've got 7% oxytetracycline, sulfas, and then we've got a bunch of them that are lumped into the other category as well. So that's a little bit of information that I just wanted to share on kind of what the VFDs are being written for. We do have some resources that I wanted to make sure to share with you today. The Iowa Pork Industry Center website, you can see that website listed there. It's got a document that we've updated frequently, kind of called the Frequently Asked Questions. I had the opportunity through the ASV to collect questions from my colleagues and then route those to FDA. And then what we're doing is every time we get questions in here that aren't answered by this, then they will give us official clarification. We can take that back, update this document, which is located on the website, and it's just good for some very common questions that we were getting as we were doing some of our educational ones. So there's about a 15-page document listed on that website. You know, one of them the question was is how close does the client have to be to feeding to the intended duration of feeding, and the answer we got back is, you know, very close, and that on those labels it very explicitly says how many days of duration that animal is supposed to be fed. Now in the past, you know, we probably got very comfortable with kind of converting that into a batch size and didn't really worry about the duration fed, but as we expect that inspections will ramp up, that is something that they clearly want to see on the documentation. Which date did you start it? Which date did you finish it? How close did you hit to what the VFD was saying for the duration of feed that was fed? So that question and many other are in those 15-page document. We were also getting questions at the same time about some of the prescriptions for the water-based mass medications. So we took those questions to the Iowa Board of Pharmacy. So this would pertain more to just prescriptions written in the state of Iowa. That's more of a state-by-state process. But we were able to put together a similar document with that website that's listed above there to download. One of the common questions that we get from veterinarians is about labeling of products for prescriptions. And the question is, can you label the container, or do you have to do each of the individual packets? So one of the responses that we got back is if the container is unopened, you can label the entire container and you don't have to label the individual packet. So probably a little bit more for veterinarians out there, but that resource is there. And with that, Heather, I'll go ahead and pass it along for the next speaker.